Last year, my father experienced severe chest pains. He called 911 and an ambulance rushed to his aid.
But in that critical moment, something went wrong. Vital information about his condition was lost, information that could change his treatment. This isn't just Martin's story, it's a systemic problem in acute healthcare.
In the acute setting of Norwegian healthcare, we have two problems. The first problem occurs in the field. The conversations of first responders contain valuable information. Today, this data is lost.
The clinicians are too busy saving lives to take notes. They rely on a brief oral handover at the hospital, often to nurses who lack full context. In addition, human memory is vulnerable to information loss, increasing variability. The second problem is the medical records may contain vital information, which is not available in an acute setting with time constraints.
Let's walk through my father's case. This is how we ensure no information is lost and the correct treatment is chosen.
He calls 911. We automatically initiate an emergency response document for the case. The ambulance is dispatched.
Clinicians arrive and assess him. They talk to the patient and to each other about his medical condition and the needed therapy. They're too busy to take notes. Our system records their conversations, both between clinicians and patients and in between each other. In this way, the valuable information is not lost.
The patient is placed in the ambulance and the therapy continues. They follow protocol and perform emergency treatment. Also, these events contain valuable data for downstream clinical treatment.
The ambulance arrives at the hospital area. This initiates the data processing pipeline of our product. The audio recorded of the first responders is transcribed automatically. Llama 3.3 then processes this input, performs linguistic analysis of the text, and generates a precise medical summary of the conversation. But we don't stop there. We also integrate the entire patient's medical record, flagging critical information like allergies or contraindications. Again, we use Llama to analyze the complex patient history to make a concise summary. We integrate that into one single report. The summary arrives at the same time as the patient. It includes a flag. Martin's father had a previous brain hemorrhage, making thrombolysis dangerous. The treatment plan is adjusted from thrombolysis to PCI, saving his life. Without the provided capabilities of Llama, Martin's father could have died.